welcome to another interesting episode of Health Watch. Last edition, we talked about eating right, and one of the emphasis that was made by the doctor, Dr. Destiny Aluge, she talked about the importance of adding vegetables and fruits to our meals. Of course, we know that when you add vegetables and fruits to your meals, is a good source of vitamin, and of course, it helps your diet and it helps you to stay healthy. Now, this week, it's like a continuation of last week's edition, but a different topic entirely. And this week, we're looking at diabetes. Yes, I know the first thing that comes to your mind is sugar. That is what everyone knows about diabetes. You just know that it's something about sugar. But today, we brought you an exclusive interview with Dr. Femi Fasanmade. He is a consultant diabetologist. He'll be telling us all we need to know about diabetes and how to manage it. We'll also go on the streets to find out what people know about diabetes. It's another interesting time on Health Watch. My name is Nkem Okibe. Stay with us.
Okay, diabetes is I think it's about sugar. When you have too much sugar in your body, that's what I know about diabetes. So, and it's good for you once a while, even if it is once in 3 months, you go for checkup to know your sugar level.
Diabetes can be caused by sugar, excess of sugar.
What is diabetes? What are the warning signs? So maybe we should start off with what is diabetes?
Diabetes is a chronic disorder. When we say chronic, it means something that once diagnosed is usually lifelong. So it's a chronic disorder. It affects our metabolism, which is the ability of our body to handle carbohydrates, and also to some extent the ability of our body to handle fats and protein. And the main way it manifests is that the blood sugars start to rise and they become persistently elevated. So in layman's terms, we will say that diabetes is a condition in which the blood sugar is persistently elevated, or the blood sugar needs to be regulated by using blood sugar lowering drugs. The disease in many people does not have any signs. More than half of people don't even know they have it until we do a general checkup. But in those who have signs of the disease, those who present with some of the features of the disease, what they often present with is they're passing plenty of urine, they'll be feeling very, very thirsty, quite a number of them start getting tired, they lose weight, vision may become blurred, and in quite a number of people they may have peppery or painful sensation in either or both of the legs. So these are some of the ways that a person with diabetes might present. In some other people, they might notice that there are frequent occurrences of boils. If you have boils in your armpit, boils in your groin, or boils all over the skin, or generalized itching of the skin, all of these are different ways that diabetes might present. Some people have a wound that fails to heal, or stays for many, many, many months before it heals. All these are some of the ways that diabetes might manifest in a person.
Tell us about the two types of diabetes.
There are two main types of diabetes. The less common one is called type 1. A person who has type 1 diabetes requires insulin on a daily basis for his very, very survival. Stopping the insulin for more than a day or two might prove very, very fatal in such people. So these are people who are called type 1 diabetes. Very often they are younger. Some of them may be as young as 2 years or 3 years or 4 years. So if I see a child, a very young child who has diabetes, most likely it is type 1. On the other hand, the other type is type 2. Type 2 diabetes, usually these ones are able to control their diabetes using tablets, or sometimes they might need tablets together with insulin, and they're usually much older than the type 1 diabetes people. These are the majority of the patients, meaning that we have about 95% of the people with diabetes actually being affected by type 2 diabetes. There are other rarer types of diabetes. And another one that is important that we should mention is gestational diabetes mellitus. That is diabetes that occurs or manifest for the first time during pregnancy. Usually with the conclusion of that pregnancy, that type of diabetes abates, but the person remains at risk for either type 1 or type 2 diabetes at later times in their life.
Is diabetes, is it hereditary? Because I've seen some families where it runs in the lineage, and even despite the fact that some of them try to live very healthy lifestyles, they still come down with diabetes. So is it hereditary?
Diabetes, when you look at the causes of diabetes, there is not one specific cause of diabetes, but there are several factors. We can divide them into two broad groups. One of them is environmental. When we say environmental factors, we are saying things that you encounter in your day-to-day life. And then the other one is genetic or hereditary. The genetic or hereditary is when you have, for instance, if two parents, husband, wife, have diabetes, their children are at a very high risk of diabetes. And if you follow up these children long enough, you will find out that quite a number of them will come down with diabetes. If it is just one parent that has diabetes, the children are also at risk, but not as at higher risk as those who have two parents with diabetes. So this is the type of diabetes, this is the aspect of diabetes in which we say it is hereditary. On the other hand, there are some people that nobody at all in their family has diabetes, but they come down with diabetes. In such people, usually there are things that they acquire in the environment, either diet or lack of exercise or too much stress or some medications or some toxins. All these are the things that we call the environmental factors that lead to diabetes. In a particular individual, usually there is a contribution of both, meaning that there will be the hereditary aspect, there will be the environmental aspect. So if a person has both parents who are diabetic, and the person now exposes himself to things in the environment that promote diabetes, for instance, the person is overeating, the person is not exercising, the person is taking a lot of soft drinks, a lot of alcohol, then such type of person who has a strong family history of diabetes is likely to come down with diabetes very early. But if you have both parents and one parent with diabetes, it's not all bad news, because if you adhere to a healthy lifestyle, meaning that you exercise well, you keep your weight in check, you avoid taking excessive alcohol, you stay away from refined carbohydrates, the type that you find in soft drinks and in fast foods, and you do a lot of physical activity, moving around, you will find that that person, the chances of him or her developing diabetes are much, much less.
For those joining us, the program is still Health Watch, and we're talking diabetes. Before we went on the break, we talked about the causes, and you talked about environmental and hereditary factors. One of the questions that came to my mind, I know you talked about the relationship between diabetes, pregnant mothers, and even children. Now I want to ask you, how come we find younger people coming down with diabetes? What's the cause?
Well, younger people are coming down with diabetes now because our youth are getting bigger, meaning they are getting fatter. Also, the playgrounds are getting fewer, so the youth do not get as much exercise as they used to get before. And then to make matters worse, quite a number of children are either chauffeur-driven to school or they go with the school bus. So you find out that you have removed almost all of the physical activity of children. Even the times that they used to play out in the playgrounds, parents now enroll them into summer coaching, into evening classes, into private lessons, so there is no physical activity. So if you see children of this age and you compare them with children of like 2-3 decades ago, you will see that these ones are fatter, they are chubbier. So these children are at a higher risk of developing diabetes. Also, what they eat, children have access to a lot of refined food and fast food. So parents who think they are doing their children a favor by putting meat pie, putting sausage rolls, putting fizzy drinks into their children's lunch packs, they're actually doing their own children a lot of harm. So they should return to the traditional method of giving their children sandwiches and an apple or an orange or a banana.
So let's quickly look at the effects of diabetes on body organs.
Yes, when you have diabetes, it's not just sugar alone that is affected. The blood sugar rises, but that leads to damage of almost all the organs in the human body. For instance, if you go from head to toe, diabetes is associated with an increased risk of stroke. Diabetes is associated with an increased risk of blindness. You find that if you see a patient who has a stroke, if he's not hypertensive, most likely he's diabetic. Also, diabetes is associated with heart attacks and heart failure. Diabetes is associated with kidney failure. Diabetes is associated with gangrene of the feet. They have pain in the feet or sometimes no pain in the feet, and if they don't take proper care of the feet, they develop wounds, and these wounds don't heal and the leg starts to decay or rot, and very often they lose their lives in the process, or that leg has to be amputated to save the person's life. So diabetes has effects on almost every part of the body.
This these days you find a lot of young people saying that after all Jesus turned water to wine, so they want to give you that excuse for them to take alcohol. Is there any relationship between alcohol and diabetes?
If you take excessive alcohol, you can damage the liver and you can damage the pancreas. These are two very important organs which contribute to regulation of the blood sugar. So we tell people, please abstain from alcohol. There are many people that will say, yes, some wine is good for the heart, some wine is good for different parts of the body, but that is just used as an excuse to overindulge in alcohol. Alcohol on its own, medically, nobody has any issues against it. But the problem is overindulgence, taking excessive amounts of alcohol. Alcohol also, you should remember, is an important source of calories. So a person unfortunately forgets that there are calories in alcohol. So he eats his regular size of eba, amala, and then drinks a big bottle of stout or beer. Without remembering that that is not water, that contains extra calories. So they end up putting on weight. And that's why you see that people who drink a lot of alcohol, they are fatter. And often you see they have a pot belly from excessive fat in the liver and in other parts of the abdomen. So my message to people who take plenty alcohol, reduce the amount you are taking drastically. For those who have not started, don't bother starting, because you might be starting on a journey that you may not be able to return from. Because alcohol, just like cigarette smoking, is addictive. The other thing that people who have diabetes shouldn't indulge in is smoking. Smoking worsens all the complications that I mentioned, ranging from heart attacks to stroke to blindness. So people who are not diabetic should not smoke. People who are diabetic should not smoke.
What sort of food should a diabetic person stay on?
Well, when it comes to diet, the best way to describe the diet is if you go to the interior, meaning the rural areas, the typical type of food that people in the rural areas, irrespective of the part of Nigeria they come from, that is a diet that is recommended. And whether it is north or south, you find that those diets, there is plenty of vegetable, there is plenty of fiber, there are plenty of cereals and nuts, and these are not highly refined foods. So whether it is acha, whether it is gari, whether it is elubo, whether it is amala, whether it is fufu, all those meals taken the way they are taken in the village with plenty of vegetables, no soft drink to go with it but water, those type of diets are the ones that people should indulge in to prevent diabetes. Then when you now move from the rural areas to come to the cities, the ones that the city people like taking, those are the ones that cause problem. Meat pie, puff puff, buns, cake, biscuits, soft drinks, juice, malts, beers, sweets. All those are the problems because they contain refined carbohydrates, refined sugar, meaning that sugar that does not need much digestion before it is absorbed. And that puts pressure on the pancreas, which regulates blood sugar control.
So finally, sir, what would you say are the preventive measures? Because I'm sure that a lot of people have been educated. You said a whole lot of things today, and so it's also important to put yourself in check so you don't get you don't come down with diabetes. Because I'm sure from a lot of things you talked about, now it's obvious that it can be managed if you live the right lifestyle. So what would you say are the preventive measures for all of us to put in mind?
The preventive measures are to live a typical rural African life, meaning plenty of walking, plenty of water, plenty of vegetables and fiber, fairly large quantity of carbohydrates, which is complex, and then to abstain from alcohol, abstain from soft drinks, abstain from sweets, and abstain from any other refined sugars, including the sugar you put inside your tea or Bonvita. So if you are able to do that, living a fully active life with a sensible, healthy diet, then you can prevent diabetes.
Okay, now to the big question: can diabetes be treated?
Diabetes has no cure. All we just do is to manage it. We manage diabetes, meaning that we keep the blood sugar in control by a combination of lifestyle and a combination of diet and exercise. There is no cure. So if you see any claim on the social media or in any other form stating that they have a wonder drug or a cure for diabetes, most of them are false, or they are saying it, they are trying to give it a sensational view so that people can flock to that place, and then they now start to explain to you that, well, you need to treat it for some years or so on. Diabetes is treated, diabetes is managed, diabetes is not curable.
Thank you, Dr. Femi Fasanmade, for sharing that vital information on diabetes. You know, I mentioned earlier at the beginning of the program, I talked about that this edition is like a continuation of last week's edition, and this week we're talking about diabetes, and you could see that Dr. Olufemi still has the same advice, and is also telling everyone out there to eat right. And eating right means eating vegetables, balanced diet, avoid fizzy drinks, avoid your not regular meat pie. And that's the much you can take on this week's edition of Health Watch. Remember to send a text only to 07060865487, or send a mail to okibenkem@gmail.com or healthwatch@gmail.com. Remember that health conscious people live longer. Prevention is cheaper and far better than cure. My name is Nkem Okibe. See you next week.